Dipersilakan.
Okay, hello everyone. So I am aware that we have audiences of diverse professional backgrounds here. And although this review article is fat science related, as my title suggests, I believe that everyone can benefit from this presentation. So next, please. So this is the content of my presentation for today. Next, please. So the first thing I would like to address is why acute pain management in cats is important. Next, please. So pain in cats are often overlooked. A study done by Coleman and Slingsby in 2007 proved that many veterinarians overlooked pain assessment, recognition, and management. And this problem is more worse in cats than the dogs. Although uncontrolled acute pain is associated with, but not limited to, increased morbidity, reduced quality of life, and increased duration of hospitalization and its consequent healthcare costs. Next, please. So we are talking about feline welfare. So feline welfare is the state where physical and mental well-being of the cats are fulfilled. So feline welfare enforcement at the clinic equals the vet staff responsibility. Next, please. So this is the pain pathway made simplistic. Next, please. So this is how the cats and animals in general perceive pain. Next, please. And I would like to emphasize that pain and inflammation goes hand in hand. Pain arises from potential or eventual tissue injury, and tissue injury will result in inflammation. And inflammation arises, will give rise to pain sensation. Next, please. So next, please. I'm going to discuss the third part of my presentation about the pain assessments. So we should be aware that pain assessment goes beyond hands-on exams because pain is multidimensional. Melzack and Casey in 1968 pioneered that pain has three dimensions, including sensory discriminative, affective motivational, and cognitive evaluative. So the sensory discriminative can be evaluated by hands-on feline-friendly examination that aids to determine both pain location and intensity. And for the affective motivational aspect, the unpleasantness experienced by the cat can be assessed by the use of pain metrology instruments. And also we have to involve the owner because the owners are often more sensitive in changes in behaviors of their cats. And for the third aspect, cognitive evaluative is indeterminable because we couldn't evaluate the cognitive alteration in cats when they are in pain. Next, please. So these are the common behaviors of painful cats. However, please do take note that these behaviors are non-specific. However, presence of more than one signs of this behavior may indicate pain, which should become a tip of information for further evaluation. Next, please. So I'm going to discuss about three validated feline-specific pain metrology instruments that can be used to aid a more objective assessment of pain. So whichever tool is used, training of all veterinary staff is strongly advised. And for a pain assessment tool to be both validated and used, it needs to be first valid. So it can assess the parameters. So the parameters can distinguish between the painful and non-painful cats. So it also needs to be reliable because it will be used repetitively and it should reproduce the same, more or less the same result. Next, please. So these are the three metrology instruments that I have mentioned before. There are three of them, which are UFEPS-SF, Glasgow CMPSF, and the FGS, with the abbreviation of those abbreviation is on the screen. You can check it out. Next, please. So this is the UFEPS SF. It is the only validated pain instrument that has several languages. So how to use this? So each subunit scores are going to be summed. Then evaluation starts by observing the cat in relaxed position before you approach to more intrusive or invasive assessments such as palpation. And newer study indicated slightly variable inter-rater reliability based on level of experience. So I couldn't stress this enough that training is essential. So the cutoff value, which is the statistically derived sum of all scored components that, if reached or even surpassed, warrants the use of rescue or interventional analgesia, is 4 out of 12. False positives have been reported in cats receiving ketamine-based anesthetic procedure or protocol. Next, please. So the second pain measurement is the Glasgow CMPSF. It included facial components of pain. So it has also, the study has also reported that the inclusion of facial components increased pain discriminatory ability among different observers. The second pain metrology instrument to be validated conducted in a more diverse clinical setting. The cutoff value is 5 out of 20 or above. And to use this pain assessment tool, each item is scored and then it's going to be summed, just as like the previous pain instrument. The observation starts by not disturbing the cat first before you approach the cat in a more intrusive assessment. Next, please. So the third recent addition of pain assessment tool in cat is the Feline Grimace scale, which is used on daily basis in our clinic. So other grimace scales are available and have been validated for use in other species such as horse, rats, and rabbits. It also has an application which can be used by non-fat users such as the clients themselves. So the FGS focused on linear distances between specific facial landmarks, orbital tightening, and whisker position. However, please do take note that brachycephalic breeds are confounding to be assessed by this metrology. And to use this instrument, each visible action unit is rated. And if the action unit is inconspicuous or inapparent, score is given 0. So the cutoff value for this pain instrument is 4 out of 10 or above. Next, please. Next, please. So this is an example of our cat. Okay, that he presented with hematuria. The first time he was presented on at our clinic, he scored 7 out of 10 based on our FGS evaluation. And after rescue analgesia, the pain score has deduced to 6 out of 10. Although it is still considered that the cat is in pain, we do see that the use of our rescue analgesia based on this assessment helps reduce the pain perceived by the cat. Next, please. And so this is the pain intervention, which I would not really dive into in more detail. Next, please. The key points of pain management is both the vet staff and the client are on board in this endeavor, and preemptive analgesia and multimodal pain management are strongly advised. Next, please. So these are the pharmacologic interventions, which I'm not going to focus. Next, please. Next, please. Next, please. So this is the non-drug interventions that you can use or implement to maximize your pain, your cat's comfort, to alleviate the pain.
Mohon maaf,
Okay.
dokter. Mungkin ya waktunya sudah
Next,
habis
please.
ya.
So that's all from me. Thank you for the time.